Welcome to Crown Podcasts, connecting you to today's influential Black voices, individuals whose lives are symbolic of achievement and triumph. They wear the crown. Let's get to know them, who they are, what motivates and moves them. Welcome to this episode of Crown Podcasts.
Welcome to this episode of Crown Podcasts. I am your host, Cynthia Hickman. Our guest today is Marcy Myles-Clark. Marcy is a pandemic survivor. Marcy, thank you for joining us.
Thank you for having me.
Marcy is a veteran healthpreneur, having spent the last 20 years successfully navigating the healthcare system professionally as a veteran pharmaceutical representative and personally as a caregiver and patient navigator for family members. This experience was put to the test when in March 2020, COVID-19 struck her household. Both she and her husband contracted COVID. She would recover at home. Her husband would spend 46 days hospitalized and isolated, with 28 of those days spent in a medically induced coma and on a ventilator. Today, they are both healthy, and she is the author of a #1 Amazon.com bestseller, Praying Wife, Healed Husband. Again, Marcy, welcome to Crown Podcasts.
Thank you again for having me.
Now, Marcy, you went from a near-death experience with her husband to a best-selling author in a year. Take us through your story, beginning with how and when did both you and your husband contract COVID?
Yes, so the how still remains a mystery. We mysteriously contracted COVID early March. Our last work day was Friday, March 13th. We'll never forget. And that was actually like the last work day where, most folks were starting to work remotely the next following Monday. And so we were just, a little bit fatigued as usual. Sometimes we just kind of rip and run during the week. And on the weekends, kind of, just kind of crash and burn. So we just thought it was just one of those weekends. We had just kind of overdone it. And so on Saturday, I started to feel like I had a sinus infection, a little bit of discomfort in my nose. My husband had all of the above. He was classic. He had, flu-like symptoms. He had pretty much a cough. He had a temperature, a fever. He was feeling nauseated, the whole 9 yards. But it was really the cough was kind of the concerning point for both of us. So I monitored his fever and I pretty much nursed him all week. And then come Monday, his temperature hit 101. He was intermittent, like 99 to 100 all weekend. 101 was kind of the turning point for me. And I told him previously that weekend, is if your temperature hits 101, we're going to urgent care. And like clockwork, it did on Monday morning. So we went to urgent care to our neighborhood local patient first, which is urgent care here in Maryland. And, they had already theoretically known about, COVID. So they were already prepared, but at the same time, it was so early on in the pandemic. And just to kind of shed light on how early it was, we were the 4th and 5th diagnosed in our county. That's how early it was in March. And so no one was really prepared. It was all theory at that point, but they hadn't seen many people. And so, they did test for flu and RSV, and they ruled out both of those two things. But because of his symptoms, primarily because he had a fever, but he had this really bad cough. They decided to refer us to the local Johns Hopkins affiliate to get COVID testing. So we went to the hospital same day and got COVID tested. This was Monday, the 16th. We got our results back on March 17th, and they were positive for both of us. I was kind of, at that point, relieved just to kind of know what was going on. We weren't really scared. We were in touch with our physicians. And his physician specifically, my husband actually has controlled asthma. He didn't take any medication. And he also has allergies, but again, controlled. And he's, very healthy, 56 at that time, year old. And he had a physician. We both have physicians. And he's been athletic pretty much all of his life. And so, just to kind of paint the picture, we were pretty healthy. So the doctor told us, keep an eye on his symptoms and the cough. If the cough persists, we'll bring him into the ER for a CAT scan of the lungs just to make sure everything was okay. So, he started to feel better throughout the week. But as the weekend approached, he still had that cough. And I just felt really uncomfortable with going through the weekend with the cough. So I called the physician, we connected, and by the time we connected, it was kind of late in the evening on Friday. He says, no, he says he's been coughing too long. This is how people are dying. Get him to the ER immediately. Speak no further. I was there within the hour.
Mm-hmm.
And so the doctor did call ahead. The nurse actually received us on the curb, so she was waiting for him. And you'll find out in a minute just how helpful that was for us, and how that actually ended up saving his life. And so I actually had to, because we were double jeopardy. I had COVID as well. They wouldn't let me in. So I had to let him off at the curb. They took his vitals. He was fine. He, was normal at that point. I had given him some Tylenol with codeine to suppress his cough on the way to the emergency room that his doctor ordered earlier on the week. So he was a little bit drowsy, but he was fine, perfectly peaceful. And, the cough had even subsided. And so literally I sat in the parking lot, parked the car, waited for about 45 minutes for him to come out. Thought they'd probably give him a treatment and, send him on his way. Well, about 45 minutes went by, nothing happened. So I actually called. I started to get a little uneasy and I called his phone. He didn't answer. 5 minutes later, he calls me back. He puts the doctor on the phone, the ER doctor. The ER doctor says vividly, no, things are a lot worse here than we envisioned. We need your permission to do an emergency intubation. As you can imagine, and that's ventilator for those of you who don't know, that's going on the ventilator. So as you can imagine, I just saw my whole life just flash before me. I'm having all types of thoughts, is my husband going to die? They're telling me he's in lung failure. Is he going to die? Am I going to get sicker? Just a myriad of things just going through my head, as you could imagine. And so they put him back on the phone. I just told him I loved him. And I talked to the doctor and, I just told him, look, my husband's really a great guy. He's very important, has a lot to live for. I need you to push the envelope and do whatever you need to do to save his life. And that was the beginning of things for us. That would be the beginning of his hospital stay at Johns Hopkins. And so he was at a Johns Hopkins affiliate, the same one where we had got the testing done earlier in the week. And they actually kept him in the ICU there in Columbia, Maryland overnight. And then they transferred him to Johns Hopkins main hospital in Baltimore the next day. And there he would stay on the ventilator for 28 days in the medically induced coma. Yes. And 46 days total hospitalization. So that was how things began for us.
Okay. That's quite a beginning. And you guys completely skipped the whole, doing a CAT scan of his lungs.
I didn't find out until after he actually came to a few months later. We had this conversation. I was under the impression that he had a CAT scan. I guess it's probably your background that knows that he didn't get a CAT scan that quickly, because that's exactly what happened when he went into the hospital. Apparently in the ER, they hadn't had protocols in place to do CAT scans for COVID patients. And so the doctor's quick thinking, he said, let's just do a chest x-ray. And the chest x-ray was enough to be able to tell that he was in lung failure. And we went from there. So, there's a lot of stories in that story. Just thankful for, our physician that called ahead, because again, and the nurse received us on the curb. We were able to circumvent the whole ER system. And he was basically intubated 45 minutes later. Had he had to wait and go through the normal channels, he wouldn't have made it, And so thank God for that. Thank God for, the ER doctor and his quick thinking and doing that chest x-ray. So just a lot of things there.
Was it because of his asthma that the whole ventilation process was so long? I mean, I guess what I'm asking was there already some compromise to his lungs?
No one ever said, but I believe so. I believe that him having the asthma, because asthma, as we know now, is definitely a pre-existing condition for COVID because it's a respiratory infection. And so therefore, it's just, safe to say that if you're a smoker or you have asthma or, emphysema, whatever the case may be, that you probably are already disadvantaged. So I think, to be honest, when I think about how I was mild and how he went on to be so sick, I do think that his asthma probably played a major part in that whole situation, and why I think probably one of the reasons why it aggressed so quickly, and also why he got so sick, why it was so severe. And so, those are, now we're advocates. We're on the other side. We talk to people about those things, because my thing is that, there's a lot of people out here that don't even know that they have pre-existing conditions, and I talk about smokers, right? Because we're, my husband's a 60s baby. I'm a 70s baby. In the 60s and 70s, everybody smoked. They smoked everywhere all the time. And so, there's quite a few of us probably out here who had at least, one smoking parent or somebody in the house. There's a strong possibility that we are compromised and we don't even know it. And so there's, another reason why we have to really stay on top of our health, and also some additional reasons why we need to make sure that we have physicians that we can call on for the good and the bad, because you saw the way my husband's physician was an advocate for us. So there's a lot of sub stories in our story. I could go on for days. Yeah.
What was the process of his recuperating? What was that like?
Yeah, so thank God, he actually came around, his lungs healed, and he was able to come off the ventilator in a month, literally 28 days from the time he was intubated. And he was, like I say, he was in a medically induced coma. And so when you're in a coma state, when you come out of it, when you're in a coma for that lengthy period of time, when you come out of it, you have to really just kind of reset. I mean, his body had just been ravaged by COVID and now inactivity from being on the ventilator. And so he was literally, like a baby. He had to learn how to walk again. He couldn't eat solid foods for the first month. He had to learn how to drink and how to eat. He had to learn how to bathe himself, how to get dressed. I mean, totally just had to reset, months and months of rehab, of intense rehab. He had a month of inpatient rehab when he came off of the ventilator. And he actually had, he continued inpatient when he came when he was discharged. And then he actually went on to do months of outside physical therapy as well when he got to that point. So, a very long recovery process. We are about 16 months out now. He's doing extremely well. He's made a pretty full recovery, but he had to work his behind off, to get to that point. And again, I want to just emphasize the fact that he had a good baseline and that he was athletic. And they said, had he not had that conditioning, if his body wasn't in, pretty good shape, and he didn't have anything, any major, health issues, aside from the asthma, there's a strong possibility that he would have made it. And he had some really close encounters, like 3 different times, where they didn't think he was going to make it. When he was under medically induced coma, he had a episode one time where his oxygen levels plummeted to a point where they were talking about, mouth-to-mouth resuscitation and, end-of-life measures. And they told me that if the intervention, wasn't successful, that was all that they could do. And
yeah.
So, yeah.
Yeah, it's useful, I think, for listeners to hear the entire story, hear in detail of the journey, both, in terms of hospitalization and then the rehabilitation. It's not just like you have the sniffles and then it's all over and you're back, 100% at it. And so I think that a lot of our listeners are going to find the story to be useful. How did this impact your marriage?
Yeah, I mean, I think that overall it definitely made it stronger. They say you never miss your well until it runs dry, or absence makes the heart grow fonder, all the above. And I mean, I'm telling you, I'm an empty nester, so I was home by myself for almost 2 months during a really scary period when we were all on lockdown. And I miss my husband, the comfort of having him. And there were times when we weren't sure if he was going to make it, and it was just a really scary time. And my husband and I are really close. We spend a lot of time together. We have a really good relationship. And again, you just don't really understand just how much you really love and miss and cherish a person until you either don't have them and the possibility of not having them indefinitely, is just overwhelming. So I think it's definitely made our marriage stronger. I mean, now we're both we're home a lot more together than we have been. We're both working. I'm hybrid and he's more remote. He hasn't gone back to work fully. So, we spend a lot more time together. And, prior to this, we were like two basically ships passing in the night. We wouldn't barely see each other on the weekdays. We lived for weekends. And now, we spend a lot of time together. And so, but again, after having a life threatening experience, you are so glad to be able to have that time together. So it's definitely, strengthened our marriage, and we're really grateful for one another. I know that he tells people all the time that, he went through it, but he says, I'm the hero because, everything that the emotional part, he endured the physical part, but I was on the outside cheerleading and just holding it down, doing everything that I could do to make sure that he got the proper care, which I know you can completely relate to as a caregiver. And I've been a caregiver all my life since I was 13 years old. And this is my most recent caregiving experience. I'm also a caregiver for my grandmother, who's 95 years old. And it was a lot, but when you see somebody that you love in peril and they're on their back and you're physically able, you do everything that you can do to ensure that they have the resources to be able to make it through.
Yeah. How did you manage that with your grandmother throughout this whole pandemic?
Well, grandmom is actually in a really good long-term care facility in another state, but I'm her POA and I oversee her. So she was locked down as well. I wasn't able to see her. But thankfully, I do have, good family members, and I also have a companion that oversees her care on a regular basis when I'm not there. So for grandmom, it's really just, again, just kind of being the emotional cheerleader and just, being the point guard, quarterback, and just making sure that, everything falls into place and that she has all of her resources. But it was a really scary time too, because, two of the people that I love the most, were totally out of my arm's reach, and it was me again here by myself. And I was really concerned about my grandmother because she was in harm's way as well, being in a nursing home
Right.
where everything, was jumping off and there were no vaccines then. So I couldn't see her. And then I was really concerned about her contracting COVID. That was like the last thing that I needed was for her to get sick, because I knew at her age that she probably wouldn't make it. But thankfully, again, we're on the other side. Husband's well, and vaccinated. Grandmom's well and vaccinated, still kicking it. And her facility did a wonderful job with, maintaining COVID. So she never got sick. Thank God.
Yeah. Awesome. You talked about the emotional impact and the physical impact, particularly when it came to your husband of COVID. Were there any other like significant impacts of the disease, the pandemic for you and your family?
Yeah, I would say probably for me, a lot of it is emotional, mental. I think I'm still feeling that because I was like a machine during that time. My adrenaline was going. I didn't really have time at that point to think or to feel. I was just doing what I had to do. It was all about him, and like I said, and grandmom at that point. And now that everything is, quote, normal, I don't even know if that's even true now with these variants. That's a whole nother conversation. But now I feel, I kind of can feel the burden a little bit, from my standpoint, from a mental, emotional perspective. From him, for the rest of our family, I think, again, our families were wonderful. They were wonderful cheerleaders on the outside because no one could be, even when he came home, they still couldn't visit because he was so vulnerable. So our families were great. So, not a whole lot of physical, and thank God, we had good resources in place. So, we were able to weather the storm financially. That's a blessing. And I talk to people about that now. I'm an advocate for having all those resources in place to help others get on the other side. I think the biggest thing I believe is my husband's physical and then the mental anguish that he had to overcome because, again, being athletic. And he actually tells the story. He'll, tell it verbally when he gets a chance, but he also has a chapter in our book from his perspective when he woke up from being on the ventilator. And here's a guy who is my little energizer bunny. He has so much energy. And then he goes to feeling like, going from being a healthy 56-year-old to probably feeling like a 70-something-year-old, like a 70-something-year-old, in a matter of 30 days, and he woke up, he talks about how, they told him where he was and, asked him a bunch of questions that just to acclimate and to make sure that, he was in his right mind. And he passed those questions with flying colors. But then he says, okay, I got to go to the bathroom. And they told him what happened to him, but it just didn't process until he tried to get up and go to the bathroom and realized that he was paralyzed. And so for that, itself, that was just super traumatic for him because, having been somebody who's just, the picture of good health, super healthy, and now being confined to a hospital, was anything but a hospital bed, he just had, a tremendous amount of mental anguish. And then coupled with the fact that he was there by himself, he was not able to have any visitors because, we were on lockdown. So, the hospital did a phenomenal job of trying to connect the communication. And once he came out of the coma, we were able to Zoom with him and things. But still, again, we're very close. And he knows because he's seen me be there for other family members. He knows that the minute he opened his eyes, that I would have been right there next to him. And so, he went through a lot of mental and emotional and physical anguish. I think that he went through the most. The rest of us were okay because we were physical and we were physically okay. And we knew that we could, if we wanted to, get up and go fix a sandwich and eat whatever we wanted to, or take a car ride out, or whatever the case may be. He didn't have that challenge. He didn't have that luxury, unfortunately.
Yeah. You mentioned that he wrote a chapter in the book.
Yes.
I'm curious, what, why did you decide that you wanted to write a book about this?
Yeah. So very interesting. Again, because we were so early on in the pandemic, we had a lot of interest in our story because my husband had gotten so sick so quickly and he made a full recovery. They weren't expecting him to make it. There was just a lot of media interest in our story. So they actually did they actually recorded his his exit from the hospital, his release, on a couple of our local news stations. And so there was just a lot of interest around it. But I will tell you, on the back end, while I was home, I was working remotely, and I was also doing a few things as it relates to my mental health and as well as taking care of him. So I was journaling on the back end just as a means of just kind of getting my thoughts in order, just for good mental health is something that I've always found to be very therapeutic. Secondarily, I was talking to his doctors and nurses, his providers, several times a day. And I started off writing notes on little sticky pads, quickly emerged into a full-fledged binder, and I started taking notes. So whenever I talked to someone, I would literally chart out his progress. I had, extensive progress notes. So I was journaling and I was also doing progress notes. I also had formed a prayer group, which ended up starting as family and friends and becoming international. And so I was texting my prayer group and just keeping them abreast of things so that, they could continue to pray. We had specific prayers whenever there was an episode, we would pray specifically for that. And I will tell you a little side note that he responded whenever he got into crisis, we went into prayer mode. He responded, so that's a testimony in itself, hence the title of my book, Praying Wife, Healed Husband. But I had a bunch of content, actually, when he came home from the hospital. And so family and friends started just saying, you should consider writing a book. And, I thought about it and I said, that's not that far-fetched because I really have a bunch of content. At this point, I really just need to just form the storyline and, and just kind of make it into a story because I literally had a huge binder of all his progress notes. I had my journaling to kind of tell the story from my perspective. And then I had the text messages. And, I prayed on it, which I always do. And resources came. I talked to other people who had written books and things. And I got paired with a, really tremendous editor. And we just started the process from there. And that's really how the book formed. So, and as I started to form the storyline, I said, this is basically from my perspective. I said, that's all well and good, but babe, you need to, tell your story because nobody knows what you went through, firsthand. And that's what he did. And I think that ended up being really a part of his therapy as well, telling the story from his perspective. And it's really, and I'm not just saying this to say it, but it's really an inspiring story. It's interesting and it's actually funny. So we say that it actually will make you think and it'll actually make you laugh as well. And it will make you cry. It will make you
Yeah.
cry. And, so there's a plethora of emotions there as well. My husband tells some pretty funny stories about how he started scheming in the hospital when he wasn't able to eat food. He started scheming with making his own water out of ice chips. So in hindsight, it's a pretty funny story, but you could just imagine probably what his mindset was. He was just hungry and trying to survive. So his survival skills kicked in, but there's a lot of information there.
Well, Marcy, it's obviously something that resonated with a whole, host of folk because it is a number one Amazon.com bestseller. Praying Wife, Healed Husband, Marcy Myles-Clark. Now, your family, they're COVID survivors. What's next? I'm gonna ask a couple of questions. You can, it's up to you if you want to provide any like detail, any color commentary. The first is vaccinations. Yes or no, and why?
A simple yes. Yes, you don't go through what we went through and not get vaccinated. I will tell you, my background is pharmaceutical sales, so I probably know just enough to be dangerous, which could go either way in terms of, fast tracking of drugs and things like that. I actually, we had our reservations initially about the vaccine, and probably some of them were the same as what other people are going through currently, about the lack of information and all those different things, and it, coming out at record speed and fast tracking, all those kind of things. And again, we prayed on it. We also did our research, and I think I came up with my own kind of conclusion. My husband and I both, and we were already pretty much decided, but then decided to get the vaccine. But then I heard a physician from University of Maryland, a Black woman who looked like me, basically say back in December when there were about 400,000 people dead at that point, she said, listen, if you are eligible for this vaccine right now and you look like me, you can't afford not to wait, not to get it. And that's pretty much where I was. And she was like my affirmation at that point. So that, as soon as we became eligible, we got our vaccines and we are so glad that we did. And now we are advocates for helping others to do the same.
Yep. So had COVID, still got vaccinated.
Yes.
What about wearing a mask indoors? Yes or no?
Yes, an easy yes. Again, absolutely yes. Not only do we wear our mask indoors, we actually try to refrain from being indoors as much as possible. We are still very conservative. Again, you don't go through what we've been through and take it lightly. There's too many unknowns, Dr. Cynthia, just too many unknowns, and what's happening right now with the Delta variant is just, to me, it's just icing on the cake with the unknowns. There's too many. We still don't know how long the vaccines last. We don't know who's vaccinated, who's not, because everyone's policing themselves. There's just way too many unknowns. And so we play it really, really safe. Our circle's really small these days. We really only interact with vaccinated folks that we trust and that we know are vaccinated. And we really try to, limit our time indoors as much as possible. And we also do, social distancing, and we're also doing pretty small crowds.
Yeah.
I feel like you have to remain safe right now.
I would ditto and support all of your comments.
Yes.
Any final thoughts?
Yeah, I mean, the biggest thing is that we're just, really grateful to be on the other side now. I mean, it's been, a miraculous year for us. I had no idea, no intention whatsoever of writing a book last year. nor did I have any intentions of writing a survival story. I would have thought it would have been, something more in my background, either, pharmaceutical or life and health insurance or something. But the book gave us an opportunity really to bring all of the above forward. And so, we're really grateful for the opportunity. We're grateful to be on the other side. We're grateful to be healed. My husband, I'm sitting here looking at him now. He had lost 50 pounds. He's healthy now. He's gained most of his weight back. And he's just a walking miracle. He's a living miracle. So our story is spiritual, but there's also a practical perspective where, we share resources. We talk about the importance of having a personal physician and having your medical and health insurances in place, all of your documents, your living wills and power of attorneys and your death insurances, your final expense and burial insurances. So yes, it's a testimony, but it's a step even further, to be able to help others to win like we did, in event of a crisis. And so the biggest thing for us really is the vaccine portion, and specifically as it relates to our community, because there's just so many false things just circulating right now. And we find that a lot of it's coming from social media. And we love social media. It's entertaining, but it should not be our media source, folks. It was like we all grew up, mama and grandma, somebody in the house watched the evening news or the morning news. They watch ABC, CNN, Peter Jennings, NBC, something credible, right? To find out what was going on. And but we just don't do that now. And we need to get back to that because we really need to get our facts right, because I'm just hearing just too much craziness and reasons why we shouldn't get the vaccine when it should be the other way around, folks. We're dying in record numbers. And we have a vaccine now that is free. And when my husband and I, we were so early on in the pandemic, we did not have a vaccine. We didn't have monoclonal antibodies. We didn't have remdesivir. We didn't have any of the things right now. As my pastor said, it was just my husband's body and God fighting it out, and so you all have resources now. You have the ability to keep yourself from getting sick. These are the same vaccines that we all took going to public school. It's no different. Now we've come up with all these different reasons why we shouldn't take it. And it's crazy. We are literally killing ourselves. At this point, if you're not getting vaccinated, you are signing up basically for death. You have a death wish because the variants are not playing. They are not playing. They are very, very easy, very contagious, easy to contract, and they also are, very potent and, can really kill you. And then we're talking about a population that's already has pre-existing conditions. Sometimes we're challenged financially. We don't need to miss time off work. We don't need to be in a hospital accumulating thousands of dollars of hospital bills unnecessarily. And to me, that's all the more reason why we should take advantage of a free vaccine.
And there you have it, folks. Marcy Myles-Clark is our guest today. Thank you. It's been a pleasure having you with us.
Thank you so much for having me.
You're welcome. For more information on and about today's guest, please visit the show notes for this episode on the Crown Podcast's website. That is it for this episode of Crown Podcasts. Thank you so very much for listening.
Thank you for joining us today at Crown Podcasts. For additional information on our guests and activities, visit crownpodcast.com and subscribe. You can also find us on your favorite social media platforms, so follow us at Crown Podcasts. Until the next episode.